Gigi Sukin with Colorado Biz Magazine. We are here at UMB Bank today, and we are lucky enough to spend some time with Richard Ziegner. He's the Executive Vice President and Director of Healthcare Banking for UMB Bank. Hi, how are you?
Good to meet you.
Yes, nice to meet you as well. So tell us why now UMB is focusing on healthcare.
Well, you know, UMB is it's a bank that's been around a long time, 102 years old, and healthcare has always been something that the bank does. As a matter of fact, we have 925 some odd clients today that are in the healthcare sector. So this is it's not something that we're starting from scratch. It's really, we have a nice foundation that we're going to build from. And you know, when you think about healthcare, it is one of the largest and most important segments of our nation's economy. In 2013, healthcare was 17.4% of our nation's GDP, so a really big piece, right? And that 17.4% entailed approximately 2.9 trillion of revenues flowing into the healthcare sector. And of that 2.9, about 1.4 million flowed to hospitals alone. And the numbers are really staggering. There's 4,950 hospitals in our country, about 15,000 long-term care facilities, and 10,000 outpatient centers of one type or another. So it's just when you look at the numbers, the healthcare business or healthcare segment is truly a large piece of what our country does. Not only is there already a big base of business there, but it's a rapidly growing segment of our economy. In 2013, healthcare grew at about 3.4%, which was much faster than the overall economy. But it's more than just the numbers of the economy and how big the healthcare sector is. There is also tremendous change occurring in the healthcare world today. In 2010, as you know, the Congress and President signed the Patient Protection and Affordable Care Act, and that dramatically changed the way healthcare is done in our country, and it's dramatically changed the things that are important for healthcare providers. The paradigm has just completely shifted for them in many ways. Just one example of that is that historically healthcare providers were paid by volume. So the more procedures they did, the more patients they saw, the more money they made. But that's radically shifting. And today, volume isn't how you're going to be paid. You're going to be paid by how well you take care of your clients, how good the outcomes are for those clients. So that shift is a tremendous change in risk, right? So before the risk was on the payer, but today the risk is shifting to the provider. So hospitals, doctors, long-term care facilities really have to make sure that the people that they bank with understand the Affordable Care Act, absolutely, that they understand what kind of changes that will create for their businesses, that they understand and can help their clients move forward and succeed in this new environment. So, when you look at two things, the overall size of the healthcare segment, as well as the fact that there are so many changes going on in the healthcare business today, it just really is an ideal time for UMB to really put some cohesion around the healthcare segment and try to build a really nice business around that.
Richard, thank you so much for your time.
Well, thank you.
This has been really wonderful. Thank you.
you.
Thank you so much.